This is the clinic entrance in Namu Buddha, high in the mountains of Nepal. Patients check in and collect their patient's card, for which they pay a small registration fee, but from then on all treatment is free. However, there is an evident lack of medicines, which are expensive and perishable. The monks run the clinic with dedication, but patients will soon be offered acupuncture for relieving pain and many other conditions. These nuns, together with the monks at Namu Buddha, will become barefoot acupuncturists. All are doctors of Tibetan medicine. Today is our first class. I've taken the essence and I've made it very, very practical. So as soon as you learn something, you'll be able to put it into practice. And what I want for all of you is that you develop the confidence very quickly in clinical skills. Acupuncture is one of the oldest systems of medicine in the world. It's been practiced for over 5,000 years with very little change. Acupuncture uses certain points on the body, and we apply needles or moxibustion, and this influences the chi or the energy of the patient. So what we're going to be doing today is we're going to go over the fundamental principles, the start, the way the medicine was viewed in those ancient times, the way they looked at the body in maintaining health, the way they could understand energy and the energy patterns in the body. So what we're doing, Angela, at the moment is they've been marking up acupoints on each other. And I'm getting them to help check each other as well, because that's extra training. Go on 5, and at the same time you can feel the hollow clearly on spleen 5. Yeah? So what you're doing is you're feeling, that's a good reference, so you can remember those points. You're feeling the hollows. Well, you marked yourself. This one is perfect. First of all, locate Governor 20. You can all do that. Very good. You need to come back a little, actually. You probably, it's better to do this on each other than on yourselves. Because on yourselves you tend to come a little bit too forward, whereas on each other you curve round the head and you're more likely to find it. You go this and you go back a little. So 1 inch in front. So those are the first special points. And in fact, you know, these are ones you could even needle on each other because it would be quite good practice. She's very sick, she's got a terrible headache. Okay, so what you'll have understood from that exercise of point location is you're forming a little bracelet, okay? So it's easy to know you've got your points correct. And if you're uncertain about gallbladder 40, for example, and you find spleen 5 very easy, you've got to check, because they're exactly the same, both are identical. Karma Lodre Rabsang, an experienced acupuncturist, was invaluable in assisting me with the students' clinical supervision. The students became clinically competent very, very quickly, with Lama Doctor also helping in clinical supervision. Their skills and their range of treatments was fantastic, and their love and concern for the patients very evident. They knew how to examine, to diagnose, to mark up points and be able to accurately locate hundreds of acupoints. They studied and worked so hard, they were a marvel. Our patients were very simple people coming from the villages. They were walking 2 hours, 3 hours to get to the clinic, but finding it worthwhile and coming back again and again. And then the Annies stood so proudly next to their patients. They showed us what they were doing. They explained each case and how much it was improving, how people were able to walk without pain, breathe more freely, their shoulders were no longer hurting. and their joy and pride in explaining to me about each individual case was very, very touching, and their work incredibly professional. It was an absolute joy to work with these people. I think I can genuinely say the best experience of my life. Having completed well over 200 hours of clinical time, the nuns and monks were then ready for graduation day, a very special occasion. Thank you to Khenchen Trungpa Rinpoche for so kindly steering this program and inviting me to teach the monks and nuns so that they could practice acupuncture for the benefit of so many.